Now, can move to first generation antipsychotics. So first generation antipsychotics are used less frequently than the second generation because of their adverse effect profile. But you may have already seen some of your clients being on these medications, like Haldo, Prolixine, Thorazine, Compazine. These are more frequently used. I've personally not used the second half of this list at all, ever. And in general, the preference is to avoid using them, and second generation antipsychotics are usually preferred. Sorry, here I should have FGAs in that parenthesis. It's the wrong abbreviation. So mechanism of action of FGAs is very similar to SGAs. Basically, they work on they antagonize the D2 dopamine receptors, and they don't impact serotonin receptors. So that's the difference. They work on the same dopaminergic pathways. So they help with positive symptoms of psychosis like delusions and hallucinations. In terms of negative symptoms of psychosis, these medications have opposite impact compared to second generation antipsychotics. So they decrease dopamine in this pathway. For quite some time, there was this general idea that these medications may not help with the negative symptoms of schizophrenia or may make it worse even. Now there's evidence emerging that shows that they may have a similar impact to second generation antipsychotics for the symptom numbing. And then in terms of adverse effects, they cause more extrapyramidal symptoms because they have a stronger impact on one of these dopamine pathways. And they also cause more prolactin elevation. And these are the main reasons that we try to avoid them and basically use the second generation antipsychotics in the first place. So they are FDA approved for the same indications as the second generation antipsychotics. In addition to some of them are used in severe nausea and vomiting or intractable hiccups, or adjunctive treatment in muscle spasms in tetanus. Off-label use also, some of them, one of them is used in migraine rescue therapy. But most commonly, they have the same, in psychiatry, they have the same indications as second generation antipsychotics. Considerations. Timeline of efficacy is very similar to the other group of antipsychotics we already discussed. In terms of side effects, they cause less weight gain and less metabolic changes compared to second generation medications. But they, as I mentioned, they cause more increase in prolactin. They cause more muscle rigidity and extrapyramidal symptoms, and that's why we avoid them. When it comes to workup, we do a similar workup for these medications as we do for second generation medications.